Yep.
I had a question in your role as I think it was a set supervisor. Are you still in that role?
Yeah, well, I'm actually, it's not anymore because I lead this state training committee.
Okay.
Yeah, so I do oversee it and I still have very much an interest, but it's kind of at a slightly higher level now.
Okay, because I think I've heard from, I suppose, some surgical service registrars in particular that getting onto programs these days sounds like it's very difficult, and people can feel much like you did, sort of left on the scrap heap. Are you hearing a lot of that on the ground? Do you think the landscape's changed significantly over the last 20 years?
Yes and no, actually. It's certainly in general surgery, which is what I'm most used to. There's a very clear structure of what you have to go through to be able to get on the training program. So there is a structured CV. So as part of that, you need to have, you need to accumulate points in different things, and doing things like doing a higher degree, getting some published papers, presenting at a state or national level conference gets you points. You get points for going out to the country. So that's what Joe did, and that's helped him. It's that type of thing. Then you need referee reports. And the reality about referee reports is that if you have a good referee, they will give you full marks, you know, if they're playing the game correctly. If you pick a bad referee, they'll give you rubbish marks. It's not actually, the referee reports aren't actually a great discriminator in the selection for surgical training. The one thing that does sort of separate people out is how they perform in the interviews, because they're quite a structured interview, and it's not just about you know, who you know. They will ask you clinical scenarios and how you would deal with certain situations. And I think there's even a technical question now, isn't there? Don't they get you to sort of do some... No? They had done that in the last year.
Suturing or tying something.
Yeah, because you need to show some technical aptitude, you know, because there's no point doing surgery if you can't tie a knot. You know, it's a bit of a problem. So it's actually... And when I was going through it, I mean, it may have felt different, but part of it felt as though it was not what you knew, it was who you knew. That has changed a bit. But certainly the demand to get onto the training program now exceeds the number of positions that there are available. So it is a challenge. Yeah, I acknowledge that.